My name is Amelia. I'm one of the nurses in the rheumatology clinic. If you have ever had teaching or have come to Bellevue on Tuesdays, I'm often there with Dr. Zhao. I also work as I'm a co-chair for the Disability Inclusion Network at Seattle Children's. So a lot of the work I do outside of patient care is focusing on talking about accommodations and advocacy for kids with disabilities and chronic illnesses. I don't really have any disclosures for you. I'm not doing any research with Dr. Zhao. I'm not paid by any drug companies, but like I said, I work for the Disability Inclusion Network as well. And I did bring my wife along, who is an adult rheumatology patient, and also has experience advocating for herself and getting job accommodations. So we both have personal experience with this topic and professional experience. So a couple intros to legislation that protects people with disabilities, protect people with chronic illnesses. One that if you have kiddos that are in school age, that's a big one, is Section 504 of the Rehabilitation Act. This is what helps establish 504 plans. Any educational institution that gets federal funding has to follow Section 504 of this act. The other one that comes up most often is the Americans with Disabilities Act. This protects students in schools, jobs. Even if you don't potentially consider CRMO a disability, it is still a chronic illness and it still falls under the ADA. So you are still protected by all of these laws. One that comes up a lot for parents is the Family and Medical Leave Act. You can get continuous or intermittent leave that covers up to 12 weeks of work and help you keep your benefits and keep your job and you need to take time off. And then one that a lot of people don't necessarily think of as often is the Fair Housing Act, which protects people to be able to rent and own homes without being discriminated against for their disability. Couple relevant terms that might come up. We'll talk about accommodations quite a bit, which is pretty much just changes to the environment that help make things more accessible for people. Accessibility talks about the idea that something is used by as much people as possible. A couple of my favorite things to think about when thinking about accessibility is the curb cut effect, which is named after the curb cuts in sidewalks on crosswalks. When we made those, they were mostly for people in wheelchairs. They're also really helpful for people who are trying to get to the airport with luggage, that have a stroller. So the curb cut effect speaks to if you make accommodations for one group of people, it often benefits a lot of people. And then in that same realm is universal design and making things most accessible, the most amount of people, and taking the burden off people to ask for accommodations and just making design more accessible. And then I put ableism in there, which is talking about the discrimination against people with disabilities or who just aren't as. One of my favorite quotes is that you don't have to be disabled to experience ableism. It's really grounded in the notion of who is valuable and worthy based on a person's appearance and or kind of their productivity. We live in a society that very much values productivity. That is what it is. But if a lot of times asking for accommodations is how do we get to that level of productivity that's expected of us. Really, most of what we're going to talk about today is covered in a handout that Seattle Children's made last year. It goes over kind of all the different accommodations that you can request, ideas for what to request. And this will be available as a link. You can find it online, just requesting accommodation Seattle Children's. And that's a printable version of it. First one is school accommodations, which I think most people in our clinic who are being treated for CRMO have experience with this. I think Dr. Zhao is really good at being proactive about school accommodations. We have a pretty good template that we just have readily available for people. If you've never gotten it, definitely ask. Most kids that are in public education can establish a 504 plan. And this just makes sure that you're not going to be penalized for absences for your medical clinic visits. If you have a flare-up and not feeling well, you don't get penalized for that. I think a lot of our kids usually ask for self-pacing or restrictions in PE. And then some people need a little bit more time for testing, or another one, if anyone is on immunosuppressive medications, to make it sick a little bit more often. So kind of giving that grace. Usually we have a letter template. You usually just need a letter from your doctor, and then your school can develop a plan off of that. Sometimes we get a copy of the plan and the school says, does this look good to you? Sometimes they just kind of go off of what our letter says. And then you don't have to, but I think it's easier if you sign a release of information so we can talk to the school nurse. If you have any issues with your accommodations, you can give the school a call and say, hey, what's going on? Let's chat what's going on. I know some people are joining us from outside of Washington, so a lot of Seattle Children's resources are pretty Washington specific. But if you go to your state's Department of Education or the Superintendent of Public Instruction website, all of this stuff about, and like Section 504 itself has a federal page that you can get a lot of resources from. As your kids are getting older and thinking about going off to college, Section 504 usually still applies if they're going to a publicly funded college. When you sort of get into some of the private schools, they might have a little bit different of a practice or process that they follow. Most colleges have like an Office of 504, Office of Disability, accessibility office, something that's called that. You can reach out to them and say like, hey, I've had a 504 plan in school, or if your kid gets diagnosed when they're starting college, or you get diagnosed with something when you're starting college, you can reach out to that office and they can help kind of walk you through the next steps. I think a lot of accommodations that people ask for in college are very similar to the ones that people ask for in grade school, but a lot of times the other things to consider are being able to make sure you have a fridge in the dorm. Maybe some people request a single room so that they can lower their infection risk. Some people request a car so that they can, if like freshmen are not allowed to have cars on campus, they request a car to get to their doctor's appointments, stuff like that. And then our last big one is job accommodations, which as you're going off to college, as you're moving into the workforce, this becomes a little bit more relevant. Also, parents who are taking care of their kiddos who have flare-ups, who have medical appointments, this also applies. Each job usually has its own process through their HR department. You don't have to disclose any medical information to your boss or any medical information about your child. You usually don't need as much information for job accommodations as you do for school accommodations. You kind of just need a letter that says like, hey, I'm a doctor treating this person. They have a medical condition. Please, here are maybe some accommodations that I suggest, but you can work with your boss to see what's possible in your job. One thing that's really helpful when looking at job accommodations is the Job Accommodations Network, which is a federal resource. So it's just askjan.org. This has an A to Z database of different conditions, different job restrictions, and like things that you might need to do at your job, and then it gives certain accommodation suggestions, resources. They have a hotline you can call if you're having issues figuring out what accommodations for you and your boss are just not on the same page. They can give you suggestions. So really helpful resource. Usually I think the ones that are asked for most often are, again, excused absences, remote work or a flexible work schedule so that people can take care of their kiddos, or people who are having a flare-up can stay home. And maybe like some activity restrictions and ergonomic equipment to make sure that you're comfortable at work. And then I talked a little bit about the Fair Housing Act. That's mostly for if you're renting, it helps make sure that you can make accommodations to the space that you're renting. If you're looking to own a home or you already own a home, it prevents discrimination in like loaning processes. So if you are renting and you want to put like grab bars, or you need help getting packages, or some people have asked for closer parking to their unit, that would be something that you reach out to your landlord, to your property management company, and say, hey, this is what's going on. Sometimes they need a letter, sometimes they don't. Couple things about transportation that I put on there is that most public transportation, like if you are local to the Seattle area, King County Metro, the Link Light Rail, all have like accessibility policies. That said, if you ride the Link, you know a lot of times the elevators are out. But a lot of them also have reduced fare for people with disabilities. And then if you ever need temporary or permanent disability parking, definitely let us know. We can write a letter and make sure that we're all pretty familiar with that process in our office. And then one other thing that comes up a lot, especially for those that are on biologic medications that need to be refrigerated, is how do I travel? Medical related carry-ons do not count towards your carry-on limit. So if you need to bring a cooler with some ice packs for your refrigerated medication, doesn't count. And always make sure that you're packing medical devices and medications in your carry-on luggage, so if it gets lost, if your checked bag gets lost, you still have bags. And then you can always request assistance when you like check in. They'll be able to help you get to your gate. I know if anyone has flown in or out of SeaTac, that is a huge airport. And then SeaTac also has an accessibility page that has their sensory rooms listed. They have therapy dogs at the airport. And they also are part of the Hidden Disabilities Lanyard program, where they have sunflower lanyard. My sunflowers represented here. And it identifies to the airport staff that you are someone who might need a little bit of extra help, even if it doesn't look like it. And then before we jump into talking about this, asking questions, all of that, I have a little brief thing about like, how do you advocate for people if you yourself are not disabled, or you're just wanting to help. I like to talk about two different models of disability. We have the medical model, which I feel most people are most familiar with. Like, disability is a condition that we want to help treat and cure. But there's also, looking at it from the social model, is that disability is a condition that is based on the way the world is. So your level of disability is not determined by your condition. It's determined by how accessible society is making. So the Link light rails, their elevators not being out, that's more disabling than if their elevators are working. So I think we do, and it also just acknowledges that like we are all human, our needs are all different. That is just the way that we are. So by embracing things like universal design, curb cuts, all of those, we make things more accessible and take the burden off of people with different conditions to ask for help. I think we do a good job here, especially in the promo clinic, of balancing those two. I know you guys have probably heard, and we'll probably hear more about Dr. Zhao and all the research he's doing. He is still a fierce advocate for research and like working towards the best treatments possible. He's also a fierce advocate for making sure that our environment is most comfortable for that. So we also do things like this where we can connect with our community. We have our 5K for fundraising that'll be later this year. We also have a fundraising gala that'll be later this year. Really fun to connect with people who know what you guys are experiencing. And then a reminder that these are all laws that protect people with disabilities and chronic illnesses. These are all things that your elected officials are supposed to protect. So if you're ever worried that these laws are not being protected, call your representatives, call your attorney generals and say, hey, Section 504 and the ADA are very important to me, and here's why. And then also kind of just keeping that universal design and advocacy in mind, and finding out when things aren't accessible for people. And then I'm a person who doesn't shy away from the word disability. Like I said, I like the idea of society is what's making most people disabled, not necessarily the condition that they have. So I like to point it out, and I like to call it what it is. But that being said, I know it is a word that has some stigma attached, so I'm never going to tell someone that I think they're disabled or that their condition disables them. That's something that that's just how I feel. So that's really all I got. Let's discuss, what questions do you have? What barriers have you guys experienced when looking for accommodations? Anyone having issues that they need advice on? Yeah.
So our daughter is in third grade, and we have a conference coming up. That's like next week, Tuesday. What? She doesn't have a full diagnosis yet.
Yeah.
But we've been in and out of Seattle Children's, and she misses a lot of school. We brought it up to them about a 504 plan, something like that. The guidance counselor basically told us straight out, like, no, that's not going to happen. We brought a note from the doctor. She literally said, you can't just bring a note from a doctor. She said that to her. I mean, it's not her school. We love her school. Her teachers totally accommodate us and everything as much as they can, but not having her like behind us with that is like.
But this
is why we came here to like get more information so we can, because we're
isn't
trying
her
to
only diagnosis either.
Right.
Like, she has like level 2 autism, and she's verbal stuff, high functioning though still. But with having several diagnoses, and I'm having the guidance counselor constantly arguing with us that she doesn't deserve like these accommodations because someone else is more disabled than her. That's what we're getting right now with her school.
Yeah.
There's a lot there.
And the school district, unfortunately, we're on our 3rd meeting with them.
Oh, God. The school and teachers.
District. It is a great district. It's definitely their new guidance.
The guidance counselor.
But
that's not even should be in charge of it, isn't it?
And well, their nurse, the Edmond School District nurse, is now gone. Like, they only have a nurse 1 day a week in office. So I'm dealing with specifically the guidance counselor who is telling me like
there's a lot there, but I would definitely go right here.
Yeah.
That's what,
Yeah,
for
sure.
Yeah, I wouldn't even deal with her.
We have a 504, there should be no problem.
That's what
I would even record her.
Yeah, that's actually not a bad idea.
And they didn't wait for
What she's
didn't
doing
have
is
to have the
illegal,
diagnosis to give her
No.
504. We literally just told them the symptoms she's having, the problem she's having,
Yeah.
and they were right away accommodating to get that. So yeah, I wonder what next step you should do to go around that person.
Well, we're going in on Tuesday and hoping that like that kind of changes things, because I'm going to put my foot down, and that's why we're here today, so I can get this information and be like, this is what's required.
But I asked for the district inclusive education representative in a 10-year meeting.
Yeah, you said the district inclusive.
Education representative.
Every school should have one.
Yeah,
Yeah.
and if they tell you like, oh, they can't be there Tuesday, then say, okay,
Let's change the date.
let's change the date to when they can be there. And just say we're not meeting without the inclusive education representative, because they know the laws and they won't allow that to go forward.
I really do think it's the fact that she presents so high, like
She's very high functioning.
Yeah.
But you don't have to have autism to have a 504 or just her own.
well, with even promo, they try to base it on like how she feels, but she's also one of those children who will like push herself more than she needs to, because she
She'll
doesn't
hide it.
Yeah.
It's high masking. And
Yeah.
then they come home and they're in tears for hours.
Yeah.
Exactly.
And she used to do that really bad. Not as bad now, but it's just
Especially
like
at that age.
Yeah.
She's same age.
Yeah.
And diagnosed 2 years ago or 3 years ago.
and it is that age too, like where you don't want to feel left out.
No,
And she was in a wheelchair last year.
Oh, wow.
Not given to us. She said, I didn't want to go to school because my legs hurt, so I bought her a wheelchair. And then the school had to accommodate getting a bus to our house, and they did. This year they got a bus. The wheelchair accessible, or the elevator was out. She's on the 2nd floor of her school, so it's a big school. Every time the lift was out, they would call me.
Were they prompt with these things? Like were they like
Those
way we
the
communicated?
nurse has been like amazing that we worked with the Everett School District, and really been advocating and pushing for her. She was on the phone with transportation like 4 or 5 times, demanding that we get a bus. And she's on a variance to a different school because of her high academia. So like getting a short bus with a wheelchair ramp to get her to the school school. And thankfully now she's chosen not to use it. She's been on her meds for a while, Humira. But that's how they should be, like, so
Yeah.
hopefully, I really hope you guys can find a right
We've
person.
talked about-
It's just the guidance.
We have talked about switching districts, so, yeah.
Does she have an official like 504?
No, so that's,
That's what you're
yeah,
trying to say.
so they, I wanna get her an IEP, which is an individual health plan, and a 504, that's my plan. But they're trying to tell me that even with a letter from her doctor that says, I treat this patient and she is required a 504 plan, they told me no. Like, and her doctor was very upset about it as well.
Yeah, I mean that's
Yeah,
way
I'm upset about it.
Like,
I mean,
I'm upset, it's not even my kids.
yeah.
I would tell her that you don't want her on the team, but she doesn't need to be there.
Yeah, you know, she doesn't need
Yeah,
to be
you
part of
just
it.
tell her
And even like, she's not helpful, what's the point of her being?
Yeah.
This is very helpful because like
Yeah,
I
this
was
is very
28,
great.
so like, and I went in there as a room full of like adults who were telling me like, oh, your child doesn't
Yeah.
need this, like, so.
I mean, the
Yeah, I
other
know
thing,
the
the other
pushback.
thing too is like,
It's hard
you
to, but
mentioned
the
that
kids
she's
are
like
like that.
vaccinated a lot at
Yeah.
school, like that in itself is like, your kids shouldn't have to push themselves all through school and then come home and feel terrible. Like that's still like, just because teachers and stuff don't see how they feel at home, like doesn't mean that they're.
So when I brought that up to the doctor, when like I was in a room full of adults, like her school thing, and when I said that, they told me they're like, well, her problems aren't. What did they say? Her problems aren't affecting her here at school, so it doesn't
That's
matter.
what they said.
Which when I talked to him about my son, he has ADHD, and we had meetings, they said, right now, his academics do fine. And I said, listen, this is early, and I know I see him at home. What we don't want is it to affect him down the road, which it will
Yeah.
if we don't get the accommodations now.
Mhm.
And if you don't get the support, like from your nurse, or like what you had, because there's a lot of turnover right now post-COVID. If you're not getting the advocacy that you deserve, that you hear in this room, then you keep looking, and it's exhausting, and it takes up so much time, but it is worth it in the end. So you can just say, all right, I know that this is not the way it's supposed to go, and I'm gonna find people I need, and you can go right to the principal and vice principal as well.
Use the chain, the
Yeah.
district office,
Get a
and then you
hold of
keep
that
going.
nurse when there's
If you have to
no
go to the
training.
congresswoman, then that's where it goes, but.
Yeah, I mean,
Yeah.
the office of like the superintendent is also a place that like if the principal and the vice principal are not being supportive, like go to the superintendent. Go to
Do
the
they even know what CRMO is? Did you like give
No,
them the
so-
information?
No.
Because that's what I did to start off before the
So-
before plan.
I went in there and I sat down. I was like, look, my daughter is in like the in-between stage of being diagnosed with chromo, but the doctor has told us we need to treat her with it. And when I went in there and explained it to them, I had little information because I was like literally a month or two into the diagnosis. And so I tried to explain it to them. And it kind of doesn't seem like they fully understand the concept. I don't know if they went out of their way to look up anything afterwards.
I provided them the info, but it's kind of hard being a month in because we're
Yeah.
almost 3 years in and still like hard to explain really what it is.
That's why we're having the secondary meeting though too, because I put it out there and I was like, look, she's getting to the point where if we don't put this in writing, then like they're not, when she gets to middle school, they're gonna be like, oh, well, she didn't have this before.
Right,
Like,
and
it's
you
not.
want to, especially if you have an autism diagnosis, that will help the IEP.
Yeah, and that's what I thought. As soon as she was diagnosed with a level 2 autism, because that's what they diagnosed her with, I thought that automatically qualified her. And apparently, to
Yeah.
the school district, it doesn't.
That meeting needs to happen because they have everyone in that meeting, like they should have a speech therapist, they should have a psych, like one of the.
Yeah, they didn't have any of that. They
Yeah, that needs
had
to
the
happen.
resource teacher, the guidance counselor, the principal, and then 2 teachers. That was it.
Have you requested evaluation from the school yet?
No, I have not. So I got Kaylin's evaluations all outside of the school.
Right, which is usually good, but they're legally required after you
Yeah.
request an evaluation 30 days to respond.
Nobody told me that.
Do it
Yes.
anyway.
And this is
And you can do it in writing, you just send an email, I would like to request an evaluation from my.
Did you get a letter from your doctor, you said?
for the 504 plan.
Yeah.
Yeah, I did.
That should have started that process.
And yep, nothing. It's like
The other thing that's really helpful to do is if you ever have conversations with them in person or over the phone, send a follow-up email and say, I just wanna summarize what I understand our conversation was, because then you have it in writing and
oh
you
yeah, I don't do anything besides email anymore because of things like that.
Is she the only guidance counselor at school?
So yeah, there is only one guidance counselor, and she's new this year. We
Yeah.
had a male last year and he was much more understanding, but she was in second grade, so at the time we were still like, this diagnosis is super brand new, the school year's ending, so let's not do anything right now.
Because like it's something that I have found like personally and experienced, there are going to be some people that they don't understand the law because like guidance counselors they do not get trained. They have no idea what's going on. That's why she should not have the ability to speak up and prevent any of this from happening.
Yeah.
But they just straight up do not know what the law is. They do not understand that they are like violating her rights.
And that's how I feel in general, because like I have my own disabilities. Like I have asthma, I've been intubated like 3 times. So like I have severe issues of myself and dealing with my child. Like I have always had a 504 and an IEP. I'm in college. Like, but why can't I get one for my daughter with my issues? So that's kind of why we came here. I was really interested to hear from you guys about your experiences, to hear, because the kids, promo seems like it's kind of similar.
Yeah.
And so I was wondering about like accommodation experiences for other people as well, because I didn't know that this was like my experience for my daughter was different. Like I didn't know
Have you
that.
had any accommodations like with this like pay at all?
No, so
Did she feel okay with complain of issues?
there are some times where she wakes up and she's like stiffer, and like I know that she has like pee that day and she seems okay, but then she'll come home and like the bottoms of her feet will hurt and stuff. And that is,
I've had to remind them a couple times. They're like, oh, even though she looks okay, like you're saying that they like mask it. Like even though she looks okay, don't sure if she wants to sit. Like, but it's really hard balance of like wanting to keep them still engaged and playing at the level they want to, but also not pushing them. Like they did a walkathon and they kept telling her, go, go, go. And then she would just falling apart. And like them encouraging her felt like them telling her she had to. And so like a couple of times I've had to just talk to the PE teachers again and say, I know you're doing your best and like trying to help her be active, but what you really need to do is look her in the eye and say, are you okay? Or do you need to sit down?
that makes a lot of sense, especially the encouraging.
Is that built into her 504 plan?
Yes.
Okay, because mine says, or my son says self-paced for PE, so you don't want to, you don't have to.
Exactly.
Yeah. Just
And,
know what
and
teachers too,
but like
say this is what's going on, and she gets to say whether she can stop or start.
That's another thing, is I was supposed to have the gym teacher there with us, and the gym teacher was not there with us. And I thought that would have been like a really valuable
person to be there because that's the most activity.
Yeah.
That's cool.
Every other time she's sitting in a desk, so I felt like it was really
Even that
important to have her.
although she's sat like for assemblies, they've sat on the floor and she's come home and said that her tailbone hurts for a couple of days. And the hard thing about that is like, okay, no problem, I'll put her in a chair. But kids have been trouble sitting in a chair.
Right.
So, but then she doesn't, she's like, well, I don't want to sit in a chair. I'm like, okay, well.
What have you thought about getting one of those like seat cushions that people bring to like ballparks and stuff?
That's a great idea. Send with her just and just have where she's moving around and then she can still sit on the floor with it. They have some really thick ones.
They do.
And the other thing is that those hard. I mean, even like her regular desk seat, like those things are not comfortable.
That's one reason why she loved having a wheelchair last year. She always had a chair, no matter where she went. It wasn't that she didn't, she can walk, but she still had a comfortable chair wherever she was.
My daughter has, it's in her, we built everything into her IEP because our experience with the district is they don't follow it.
With
It's not in there. Can't. And so she has a like rolly office chair that's cushioned at her desk. Like that's, and in the IEP room that she sits in, she has PE accommodations. Just basically, if she wants to do it, she can. She doesn't. She has recess accommodations. She has the ability to say, I need to go rest for a little bit, take a break, and not be penalized by that. She often, mornings are harder for her than afternoons, so we often go in late. We don't get, I don't get the nasty letter from the district, if anybody's ever gotten it, like threatening you.
I get it every.
Yeah, I know.
And I get there, I'm like, did you plan on helping me with this or anything?
I know.
We don't have anything we can do for
So
you
that's
until we
okay.
get in trouble for not doing so.
I just have a question about hidden disability, because I know that there's some genetic studies about promo, but in our family, all of us have nervous-based issues. Like, we're all neurodivergent. We've got some OCD, we've got ADHD, we've ADHD, we've anxiety amongst adults and children. And all of that is disabling. And when you talked about and you defined it the way you did, it was such a relief And one of the therapists had said, have you thought about your whole family being on disability? Like, because like I can't outwork right now,
Right.
managing my daughter's appointments, my husband's health. Like it's almost impossible, but I need to. So I'm trying to think of ways to help the whole family, because usually what I've seen with CRMO families is it's not just about the CRMO patient.
Yep.
Usually there's some other stuff going on.
Yep.
And especially if it's autoimmune, like my husband and I both have nervous systems that it looks okay. We make it look okay on the outside world because we're trying to get through. But when we come home, everyone is just like burnt out, and that exhaustion builds up over time, especially when you're managing illnesses. So what I'm asking, I guess, is there any help that families could get through the Disability Act about helping the entire family through this?
It's a great question because what county are you in?
King.
Okay. Like actual like legal financial disability is really hard to get, and it's really limiting to in the amount of money that they give. There is, if you are diagnosed with a medical condition under the age of 26, even if you're applying for this after, there is something called an ABLE account, which is a savings account you can put money into, which does not count towards like your if you do apply for disability, it doesn't count towards like disability income restrictions. But I know the King County itself, there's something called the ARC. And each county has their own like ARC division. So it's the ARC of King County. There's a lot of like charities and like institutions that kind of have resource pages. You can reach out to them. I think the ARC is the best place to start because they have a lot of global, like they just think of all kinds of disabilities rather than there's a lot of specific ones that help out people that have autism or the other thing is our resource department, another thing about your kiddo is like I talked about getting a release of information sign so that we can call the school and say, hey, what the heck?
Yeah,
one of my favorite things to do. And the other thing is if we reach out to the school and we still make no progress with them, Seattle Children's does have a medical legal partnership division that is specifically like one of their main call outs is we help people who are having trouble with this with their school.
Okay, so we're not the only ones.
Oh,
no. It was kind of relieving. It felt a little bit like I felt a little singled out in the situation.
Yeah. Like Brooke said, a lot of it is truly that people do not understand.
They're not trained.
They can't see it. So
Yeah.
And like
They're not experiencing it. When you have a disability, it's ableism. It's what it is.
And I love my parents, but they don't know.
They
don't know what to say to help me with this.
And I think it's something that's really interesting. It kind of speaks to what you were saying. It kind of speaks to what you were saying. Like, and just the whole idea is that, like, I have rheumatoid arthritis. So, yeah, some of the things that CRMO kids experience, I'm there. Sitting on the floor, can't do it. I just can't, flat out can't do it. If I'm there for more than like 2 minutes, I can't get up. She's seen it, she can tell you. Something that I think, oh gosh, where was I going with that? I got distracted. It's very isolating to be in those rooms with all of those people who are acting as if they know more than you.
Yeah.
And you're like, excuse you? No, you don't. I know my kid best. The only person that knows my kid better than me is my kid.
Yeah.
And it's really hard to be in those spaces, but majority of the time you have to know that you are going into that room with more knowledge than they are.
Yeah.
You probably know more about the law than they do, just because you've sat in this room for 10 minutes, probably got more training than they did. And then I think something else that's interesting, you mentioned your parents, like I have rheumatoid arthritis, my mom definitely has some kind of, she never got formally diagnosed, and she probably never will, but she got all right, you can tell. She's probably where I got it from. She has been masking her entire life. She has been working full time. She raised kids. She has never had accommodations. She's never had medical treatment for this RA. Which is raging. So sometimes she has a hard time looking at me where I am getting treatment and I am getting accommodations, she has a hard time connecting. She's like, well, I experienced that. That's totally normal. Why are you doing that? And you just have to remember, like I said before, you have the knowledge. You know more than they do.
I also think it's really important. I hear a lot of you guys talking about how your kids or yourselves push through work and school. And I think it's really important to remember that you deserve to have fun. Like, disabled people deserve to be happy and have fun. And if you're spending all of your energy at trying to get through school, trying to get through work, that's ableism. That's again, we value productivity. And you deserve to have accommodations at school and at work so that you can go home and have fun.
Did you say you were a hard chromo patient?
No, I'm not a chromo patient.
Okay.
No. That's what I was saying. I was saying I've experienced, like, there is symptom overlap between RA and chromo.
Right.
So it's
That's
like
kind
some
of
of
how I
this,
explain it.
yeah, so it's like, I understand some of the things that chromo kiddos, some of the things, not all of them, they're not the same, but one of the things is like sitting on the floor. Holy cow, why does that hurt so bad?
Yeah.
Sometimes it just takes one teacher or someone in the community that is accommodating and compassionate and understanding. Like Cora's fourth and fifth grade teacher, she allowed Cora to do a presentation for the class about chromo, and she educated the whole class about the disease, about everything. And then usually it comes from a teacher, not necessarily the top, unfortunately. But all you need to find is one, and maybe there is someone in your school that is on your side that you can connect with and ask to be in that meeting with you, or to say, hey, and it makes such a huge difference. So that's like.
And also get an advocate through PAVE Washington, it's just PAVE.
Yeah.
I've never heard of that.
They're amazing. They are really, really helpful. They will attend an IEP or a 504 meeting with you. They know the laws really well, and the districts tend to respect what they say. Like, if you walk in there, they know that you now know what your kid is entitled to, and they don't tend to pull off of that, what they do just with parents, especially parents that are brand new to this world. They tend to like try to roll over you.
I think a lot of the problem is I walk in there looking like I'm 15 and trying to
People
tell
think
all
she's my
these
daughter.
adults like what to do. Like I walk in there and I'm like, hey, you guys are wrong and you guys aren't listening, and it's probably really intimidating to most people who are older than me. But we'll keep on fighting for sure.
Yeah, and seriously, like, call us or send us a MyChart message and say, I was at the chromo conference, Nurse Amelia said that I can sign a release of information and you guys can help talk to the school and we will do it.
Well, luckily,
for sure.
Dr. Zhao is Caleb's doctor,
Yeah.
so luckily we have him like readily available. Like I will see him this upcoming week too. So
I just want to say thank you to each and every one of you.
Yeah, thank you.
Everything you guys have said has just been a root to a tree that of knowledge that we need for what we're about to take on Tuesday. So thank you so much.
Yeah, and also, if you guys, the handout, let me actually pull it up. I didn't pull it up because when I
wrote it down.
when I went to go get it, it was really causing me problems. So now that I've actually unshared my pretty thing, I can actually.
While she's pulling that up, something that you guys were talking about, like I said, it's one of the black knowledge, and you guys were like, no one's heard of chromo before. Before I really started working at the clinic, I had no idea what chromo was, and I've wrote 20 pages. I consider myself fairly well informed. And I didn't know what it was. You are not required to necessarily teach them. You can bring them physical copies and printouts and say, do your reading, do your research, here you go.
Yeah, I sent out counselor links.
Yeah. So
Yeah, I think to bring it in person would be a very good idea.
I think I'll be doing that.
Yeah.
So
You do both because then you got that email.
Yeah.
Oh,
Just
yeah.
proof that
Yeah.
you needed.
Like Dr. Zhao gives that folder with all the stuff in it. I just asked for an extra one and I handed it to them.
oh, that's a good idea.
Yeah, that's not bad.
Here you go.
I attach it to like the swim teacher coach because she misses.
Oh, yeah.
So I'm like, hey, by the way, here's a link to what she's put
Yeah.
in.
We're also
How does that work with extra
swim is such good exercise because it gives you resistance, but it's not like.
And I just had to talk to the third coach because I'm like,
Yeah.
she did like a whole 30-minute kicking. I'm like, and she asked for a break a couple of times, and he kept like, no, keep going. I educate him. It was the third person who didn't know that she had this condition. It gets exhausting, but it's really important.
It's
reminding
like,
them.
it's a full-time
Like,
job.
if she said she needs to stop, don't contradict her. But that's my job as like mom, to come in as mama bear every time and like remind them. Like, and he's like, oh well, she
It is
did.
such a hard
Now
thing.
I think about it, she did ask to stop, and I'm like, okay, next time you let her.
And next time, think about it.
People are so used to
And she's like,
undermining
no, don't
children.
do it,
Oh,
don't do
so
that, mom,
good.
don't talk to that. But I mean that.
Well, having that thing that says, here's what she has, this is what we do, and your job is to let her self-pace. And then they know, oh, okay, that's all I have to do is listen to the child. But what I would say is, especially having a preteen, she has this balance of, she has the power to advocate. However, she wants to fit in.
Yeah.
She does not want to leave. Right. She doesn't want to look like, she doesn't have to explain everything all the time. So it is this, I don't know if anyone has any help with that, but that's the thing we're struggling with a lot, is like how much, she's not always in pain. And right, when she's distracted, she's not in touch with what's going on too. And that's why she crashes so hard later.
later.
And I don't want that to be the thing she sets up her life to do. I want her to be able to, like you said, time for joy, because we're all burnt out.
Yeah.
And that, when you said that, I just started crying. It's like, it's hitting a nerve. Like, it's like, that's what I don't want this disease to steal away, because I've seen it not do that. Like, it's possible.
Yeah.
To still enjoy. I mean, like, she loves swimming.
When she's saying, has anyone dealt with like emotional issues based on having this disease? Because my kid was very active basketball player, football player, and now he's out of everything, and his friends are basketball players, football players. I feel like his attitude is so horrible because he feels left out.
I'm sorry, I didn't mean to interrupt you. I don't have promo, but I was a teenager, and I was a female teenager for a long time with asthma who couldn't do anything, and I was on oxygen in my living room for months on end. And, you know, I was that kid who I had to advocate for myself or I would be dead. Like, I had to carry an EpiPen and an inhaler, but at the same time, I couldn't keep up with my friends. And I started regressing. I started becoming rebellious and very angry.
Yeah.
And I think one of the best things that you can do, even at that age, like even at a young age, is if he has friends who are close to him and coming around to educate them, educate their parents, because their parents and them, those children are pretty capable of making choices that they want that are going to benefit your son in the long run, like activities and stuff. But it's so important that we keep that communication with their friends open.
Yeah.
I saw you in the room. Your son looks a little older than my daughter. So maybe his friends would be a little bit more.
I have two of them.
Oh,
It's the older one. The
Okay.
older one that looks older.
Okay,
He's
so I
12,
didn't
but
see
he looks
him.
like he's 15. And then the little one is actually 7.
I only
The
saw
little one's actually
7-year-old.
7. He looks like he's 10.
We are having
like a short
He doesn't want to swim. That's like, he doesn't want to do golf. He doesn't want to do anything.
anything that he can.
Besides football and basketball, which is very.
We are hitting the end of our time, so if there's any other breakout sessions that you guys want to go to, I invite you to leave, but I also invite you to stay if you'd like to stay and chat more.
How do we get a hold of you to forward?
Oh, yeah,
That's 12.
13 and 2, so. One of them on that also.
Do you think there's anything that you can implement that he might be able to do? Something at a lesser amount of time?
Complicated. He did all the meds.
Yes, I
We want her to do it. We don't want to do it. Because it's Brooklyn, it's kind of.
Yeah, I feel like Amelia would talk about finding information so that we can
Becomes more problem.
Like, and that's anyone who says things, they'll be like, oh no, I didn't. Thank you so much. Yeah, but these ones are. Yeah. Okay, we're going to Kobe. But there's been that.
We need Kobe.
That's what I feel, especially if your doctor sending you a letter. Like you're taking a medical professional's life and
Like, I mean, again, it's not my fault, but I'm very serious about that. So, again, it is one of my favorite things. It's a quality for like, do you guys are quality for extra paper? How many times? You tell us about what the barriers are to
Yeah, no, I didn't feel like that. It's been such an argument.
That is like, yeah, we had, it's not the first time I've called. I usually do it
6 months or
often enough.
I would want you to sit there.
Yeah.
Well,
At that point,
I mean,
yeah.
I'll be here all week, so definitely let us know.
Thank you so much.
Yeah, of course.
Yeah, it sounds hard.